So on this slide, we have a little recap table where we can see the age in which the disease is usually shown, the sex, the prevalence, the genetic or the background of the disease, and what type of arrhythmias these dogs usually have. So the Cocker Spaniel usually is presented as a middle-aged dog. There's no real sex predisposition known. The prevalence depends in the country. The background of the disease is a taurine deficiency, and arrhythmias are usually not an early sign of the disease. They can be there if the disease is quite advanced, but it's usually not an early sign of the disease. In Great Danes, they are usually presented or showing the first signs as middle-aged dogs. There are more males than females affected of the disease. The prevalence is 35%. It's suspected to be an autosomal dominant genetic trait, and these dogs can show in the occult phase atrial fibrillation or ventricular premajor contractions. In the Irish Wolfhound, the disease usually starts about 3 years of age. Again, a little bit more males than females develop the disease. The prevalence is about 30%. It's not a simple trait of transmission, and an early arrhythmogenic stage would be atrial fibrillation. In the Boxer dog, again, middle-aged dogs, more males than females. The prevalence is high, but it is less than 50%. It appears to be an autosomal dominant trait, probably with some modifying genes. And the very typical thing would be VPCs with left bundle branch block morphology. And finally, the Doberman Pinscher, the disease can start at 2 years, but it is more easy to recognize the disease at an older age. Males and female dogs are equally affected. We have a prevalence higher than 50%. It is an autosomal dominant trait of transmission, and VPCs are shown in the occult phase of the disease.